Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor, and this is a video about testing options for persistent borreliosis, also known as chronic Lyme disease, and co-infections and viruses. Um, I will get back to talking about other testing options for mold, by the by. I've been a little mold heavy of late, and so I wanted to switch up the videos just a little bit. So when it comes to testing for persistent borreliosis and co-infections, there's a different treatment or different testing options out there. One option is that you can do serological testing for antibodies. Another testing option that's become available in the last few years is doing something called ELISpot testing, which is enzyme-linked immunospot, which is a testing method that looks for a T cell response. So antibodies are made from B cells, and then T cells are T cells. So they're just a different type of immune system cell. And then there's another type of testing, which is PCR testing, which is not new, but there's a company that came on the scene several years ago now, and they test for the presence of DNA of Lyme and co-infections in a person's urine. When it comes to testing, the question mark in my mind is, well, what is the test actually looking for? In the case of an antibody response, the test is looking to see, have you been exposed to that microbe? And in many cases, antibody testing can also tell you whether there's a current infection or not. But the problem with Borrelia, at least, is that sometimes the antibodies that would normally be present in the face of that would only be present if there was an active or a new onset infection or a recent infection, will actually sometimes persist for years and years. So what I'm specifically referring to is something called IgM antibodies. In most infections, those won't persist for much longer than I'm pretty sure it's around 6 weeks or so. With Borrelia, they've done some studies showing that they can persist for sometimes up to 7 years. So when it comes to doing antibody testing for Borrelia, at least, in my opinion, to my understanding, you can't definitively tell whether a person still actually has an active infection when they have a positive antibody response. And I think that's problematic because if I do a test, or maybe not problematic, but it's something that it makes the test less valuable in my opinion, because if we do a test and it tells me that, okay, yes, there's antibodies, well, I want to know that the patient's actually dealing with that infection right now. If it was something they were exposed to 7 years ago and they're not sick from it anymore, then I don't want to treat them for that thing. I want to know, is there an infection right now? And to my understanding, antibody testing for Lyme co-infections is not able to definitively tell us that. The ELISpot testing is different. The ELISpot testing is looking at these T regulators, or these T cells rather, and they have a very finite lifespan. They have a lifespan of about 7 weeks. So if you have a T cell response to, say, Borrelia or Bartonella or Babesia, then what it indicates is that that microorganism has been inside of your body sometime within the last 7 weeks. So that's much more, in my opinion, much more useful to tell us if you actually had that infection in the last 7 weeks, and if you've been sick for the last 2 years or 5 years or what have you, and you have the symptoms that would be coinciding with, say, Borrelia or Bartonella or Babesia, and then we do a test for T cells and it says you have T cells against Borrelia and Bartonella, let's say, then I'm going to put 2 and 2 together and say, well, you've been exposed sometime in the last 7 weeks. You've probably had these in your body for the last 2 years or 5 years, however long you've been sick for. And so the take-home message is that it's more reflective of, is there an ongoing active infection right now, or are those microbes still in the person's body? In a similar vein, the urine PCR, or urine DNA testing, also should be reflective of what's in the body right now, because if we collect a urine sample and we see, oh, there's DNA of Lyme in here, or Bartonella or what have you, i.e., some of the body parts, if you will, of the microbe, then that would mean, well, it's coming from inside your body, meaning that you must have those microbes living inside of you. So listening to the story from that perspective, it sounds like, well, it's kind of a no-brainer. Why wouldn't we just do an ELISpot to look for T cells, or just do the urine DNA test, and then we know if there's an infection right now? The reason it's not a no-brainer is that with those tests, they haven't been rigorously validated. The ELISpot test for Borrelia has been fairly well validated. There's been a couple of studies done showing that it seems to correlate, well with they've done validation studies showing that it does seem to be a useful test. But to my understanding, to date, as of today, which is February in 2020, I haven't seen any studies yet where they've done ELISpot validation testing for any other co-infection like Bartonella, Babesia, Mycoplasma, etc. Similarly, with the provoked urine testing, looking at DNA of the various microbes, to my understanding, that also hasn't been validated through any independent studies. We do know that these microbes like Borrelia and co-infections, they do get into the bladder, and so it's a valid excretion to test, but we just really don't know what the false positive or false negative rate is for these tests. And that's a big limitation, because if the result comes back positive, well, I want to know, is this 99% reliable, or is it only 30% reliable? And if it's negative, then is there a 80% chance that it's definitely negative, or is there a 40% chance that it's definitely negative? So it's might as well just flip a coin at that point. So where we don't have those validations studies, it really does call into question the value of those tests. So what we're really left with is waiting for those validation studies to be done, and hopefully they will be someday. And what we're also left with is our best clinical judgment and experience, and we see, well, how useful are those tests? And I can say from my experience, I have run all of those types of tests over the course of time, and I find that the ELISpot testing and the provoked urine DNA testing can both be very useful. It is something that I have found the results to be quite useful in clinical practice. It's been quite rare that the test says yes, you've got this issue, and then we treat for it and nothing happens. It does happen once in a while, but it's not often that happens. I have definitely had cases where we do the testing, nothing comes back, we wind up treating for microbes anyways, and we do get a clinical response. And in that case, it begs the question, well, were the tests fraught with false negatives, or maybe the tests just weren't looking at the exact right microbial species? So doing an ELISpot, to my understanding at this point, you can only do ELISpots for Borrelia burgdorferi. So if a person has, say, Borrelia miyamotoi, they're going to test negative in all likelihood. Or if they have Borrelia afzelii, they're going to test negative. So there are those limitations to the test as well. So those are just some thoughts about the different testing options. I think I'll post next about the other option, which is doing something called a therapeutic trial. It's one of my favorite options because it's just faster and much less expensive than these tests, but I'll save that for the next video.